CMS has now released these new SDOH codes, and looking at them, I don't know how many folks had a chance to really look and see what were the codes that were added. And I think, some of the things that were important, and just to talk about, some of the new ones. So if you've had an opportunity to look at the infographic, you can see, they've added some around problems related to education and literacy. They've added some related to housing and economic circumstance. And I think that those were expected, though I think that there's still opportunities to flesh out some of those a little bit better. But one of the things that I found really interesting were those that were newly added just in this last release, and that was related to problems related to upbringing. And I just find that so fascinating because absolutely appreciate how important, right, environment and epigenetics play in the health, right, of an individual. But I think what's interesting about choosing these to be the social determinants of health that CMS that would want to capture is just, there's a lot of stigma and a lot of challenge around capturing SDOH, and not that this all has to be done in the physician office. It doesn't. There's lots of opportunity to pick up information, but just knowing the challenges, right, about having these types of deep discussions. And so I think that there's definitely an importance on fostering that deep relationship. Z codes can be self-reported. And so I think that there needs to be a lot more discussion around how do you take in that information? Where is it coming from? What's valued? Does it have the same weight? Not that it shouldn't, but just things, right, to really think about. And then I always think about, what are the consequences potentially? And consequences can be positive and negative, so it doesn't necessarily mean that it's a bad thing. But what does that do, right? And what does that do to downstream systems? And how does that help tell a story? And I think that there's also opportunity to talk about the safety, right, of data. If people are sharing things, deeply personal things about their upbringing, right, and whether or not they grew up in an abusive household, or did their parents, right, abuse alcohol, and did they witness that at a young age? Looking at these types of codes, how does that figure into the entire social milieu and how someone might, or milieu, and how someone might take up their own health care? And I know that some folks might say, well, maybe they don't. Maybe it's not intended to do that. And maybe that's the case, but I just can't help but wonder why, why those codes over others that maybe could have been shared. Why, and again, I think we know the effects, right, of these things, and how childhood experiences are not things that can easily be left behind. But why CMS at this point chose to include those. And I think it also speaks a lot to, when we talk about health equity and how important there are several factors, right, or several facets of who a person is that goes into, how they live their life and their different behaviors and practices, and then how that surfaces in their health and in their overall health care, and how that impacts the system.